Good morning. My name is Cheryl Dalton and I'm a volunteer at Least of These, and I'm a retired nurse practitioner, and this is Grace Wolf, and she is a nursing student, a junior nursing student at MSU. Today we are going to video for you how to do proper hand hygiene using the hand sanitizer, how to put on and take off gloves properly, and how to wear a mask. Masks are now recommended to help prevent the transmission of the COVID virus. All of these measures and behaviors are to help you stay safe as a volunteer, so you can continue to serve in the food pantry. So, welcome, Grace. So the first thing I'm going to do is show you that Grace has her hair pulled back. This actually is important so that your hair doesn't fall into your face and that you feel the need to use your dirty gloves and push the hair away from your face. So pulling your hair back is an important measure to prevent COVID virus. The next thing we're going to do is look at using hand sanitizer properly. So when you use hand sanitizer, your hand rub should be up to about 20 seconds. So you use 1 or 2 pumps, and as you see, Grace is rubbing them vigorously on her palms first. So you rub it into your palms, then you go to the back of your hands and get in between your fingers. This is very important. Both hands in between the fingers. Then don't forget your thumbs. You have to use your thumbs, so you rub your thumbs together. And then to get your fingertips, you are going to rub these hand sanitizer into your fingertips. A good 20-second count is to sing the birthday song to yourself twice. Then you rub your wrists, and then just continue to rub until your hands are completely dry. Keeping your hands dry before you put on your gloves will help you get your gloves on. So we're going to let this dry. Okay. Now Grace is going to put her gloves on. And if you can, to do a glove that fits you well, it's a little hard. Sometimes we have to use big gloves and they're a little uncomfortable. Now, I want to remind you that when you have the box of gloves, make sure you also have some hand sanitizer available and a trash can at the station. All 3 of these are important to provide good hand hygiene and using a face mask. So Grace just spent her 5 hours volunteering, and her hands are now, she's going to take off of her gloves. And this is the proper way to take your gloves off. Being close to a trash can. Grab the palm and pull out your first glove, bundle it up into your next hand, then put your hand under the glove, pull it out, and drop both of them into the trash. You then do hand hygiene again. That's very important in case you accidentally contaminated your hands during removal of your gloves. You can see she's doing an excellent job of doing palms, backs of your hands, finger web spaces, thumbs, wrists, fingertips, and wrists. This is the same hand scrub you would do if you were using soap and warm water. Thank you, Grace. So now we are going to practice putting a face mask on and gloves. So again, you begin with hand hygiene, which Grace just completed. She's going to put the mask on. I don't know what kind of masks Least of These will be getting. Some have loops over the ears and some have ties. This has a tie. You do your upper tie first. Then your lower tie against the nape of your neck, away from your hair. If you have a manufactured face mask that has the metal piece up at your nose, fit that closely to your nose, and then you won't have your eyeglasses fog over. So it's important, and then she has it pulled down over her chin, so her entire nose and mouth are protected. If you wear contact lenses, it is recommended you wear glasses during the COVID exposure to prevent any bacteria or virus from entering the eyes, but that's up to you. So now she's going to put her gloves on. And remember, when you're at a station, make sure there's a trash can, boxes of gloves, and hand sanitizer. And now she's ready to do her volunteer work in the food pantry. And now we're going to show you how to take these off. You first remove your gloves correctly. Notice she pulls it off, holds the dirty glove in one hand, slips her hand under where it's clean, drops it into the trash, and does her hand hygiene. Following hand hygiene, she removes the mask. She undoes the top strap, and if it's the ear ones, you just put it under, take it off over your ears. Now, since this is a reusable mask, she's going to fold the dirty part, which is the outside of the mask, against itself, and then this can be placed or hung in a safe place or put into a bag for reuse. Once you go home, you should take off your clothes and your mask and throw them directly into the wash and jump into the shower and get clean. So then she puts her mask in a safe place and again does hand hygiene before she leaves. So now we are going to look at some do's and don'ts. So one of the do's and don'ts, Grace is going to put some gloves on. And we'll first start with some do's and don'ts for those gloves. Once you have your gloves on, it's important. They're considered contaminated. Do not touch your face, scratch your nose or your eyes. And if you're going to get a cup of coffee or a break, you really should avoid getting those gloves in the mouth because you're contaminating your cup and putting it into your mouth. Another don't is that your cell phone goes off and you have your gloves on and your phone's in your pocket and you pick it up and you yakety yak on the phone using dirty gloves. Before you answer your phone, remove your gloves, do hand hygiene, and then you can use your phone safely. Okay? And so now we're also she's going to put the mask on, and we're going to show you some don'ts with your face mask. So you have your mask on. And you've been working diligently for a couple hours and your hands are considered contaminated and gosh darn, that mask is uncomfortable, so you're going to reposition it. The outside of the mask is considered quite contaminated, so you do not want to touch the outside of your mask or reposition it. Another thing you don't want to do is you want that cup of coffee, so you're just going to pull that mask down, drink your coffee with your dirty gloves, and then put that mask back on because you have just contaminated your face. So those are some quick do's and don'ts for wearing a mask and gloves. So now we're just going to watch Grace correctly remove her gloves one more time. The gloves into the trash. Hand hygiene, 20 seconds. And then mask removal. And if it's a disposable mask, it just goes straight into the trash. If not, fold the dirty part together and place it in a bag to take home to wash. And after she removes her mask, one last time is hand hygiene. And that's it. Thank you, Grace.
Thank you.
Stay safe, volunteers. The community needs you. God bless you.